As a state, we rank #1 in the nation for rates of femicide, deaths to women by the hands of their partner. Violence is sort of a long history in the Southeast of men towards women.
In Charleston, with the help of a Duke Endowment grant, the Medical University of South Carolina's College of Nursing is teaching future medical professionals to routinely screen patients for domestic violence, even when no signs of abuse are evident.
What I tell residents and students is that it's not always an obvious presentation, and in fact, most often it's not, because a woman won't come in for her visit if she's covered with bruises. She'll cancel that visit and come later.
Under the new program, MUSC is screening all pregnant women who visit the clinics for prenatal care, sometimes delving into the most private places of home life. Gaining the confidence of women in disclosing such closely guarded information is often uncomfortable for the medical professional.
First of all, we make sure that the healthcare provider understands how prevalent violence is in our society and here in South Carolina. We talk about screening for problems like diabetes and hypertension in pregnancy, but we know that the rates of domestic violence are double or triple that.
What I see my role is as a person that can teach other providers how to do this on a routine basis and be comfortable with it, so that then it creates an environment of comfort for the woman to be able to disclose this information that's so difficult to talk about.
We do know that if the provider is comfortable with asking the question, the patient is going to feel comfortable answering it.
MUSC is using Duke Endowment grant funds to produce a video on domestic abuse. It is geared toward educating the average South Carolina woman. In Asheville, a Duke Endowment grant to Mission St. Joseph's Health System targets child maltreatment in western North Carolina. Dr. Cindy Brown is a pediatrician whose practice is limited to child abuse and suspected sex crimes.
Out of the top 20 counties with the highest rate of child abuse, we have 10 of them. So for whatever reason, western North Carolina appears to have a higher rate of child abuse than other areas.
At Moses Cone Memorial Hospital in Greensboro, Duke Endowment funding has dramatically changed the way sexual assault cases are processed and prosecuted.
We're suffering from what I call the CSI syndrome. And you have all these CSI Miami, and then there's another one, Cold Case. There's at least 5 of these shows that are constantly implying that law enforcement has this almost magical ability to come up with evidence. And in many cases, that's just not true.
When a sexual assault victim presents, 85% of the time here, there are no bruises. There's no physical marks on them. Their hair hasn't been ripped out. They haven't been strangled. They haven't been beaten or kicked or cut with a knife or stabbed. So their injuries are not life-threatening. They're not going to die from what's happened to them. So we would ask them to wait and have a seat in the lobby while we took care of what we called the more acute victims, the gunshots, the stabbings, the chest pains, the heart attacks, those kinds of things.
And the waiting would take hours upon hours. Now with the room set aside for sexual assault cases and with sexual assault nurse examiners on call, victims are treated with more dispatch and compassion. With the help of sophisticated tools such as cameras and microscopes supplied under the Duke Endowment grant, the forensic nurses now rarely have to go to court. When defense lawyers get a look at the quality of the evidence, they often scramble to work out a deal. No community is immune from the problems caused by domestic violence. But with grants from the Duke Endowment, more and more hospitals across the Carolinas are finding ways to help their communities comfort and treat victims and to prevent abusers from striking again.